Thanks for hanging out today on Inside South Florida. Managing pain is a day-to-day experience for many here in South Florida, with people looking for better alternatives than the traditional pop-up pill and deal course of treatment. Recently, I sat down with Dr. Amol Soin, president of the Interventional Pain Physicians, who shed some light on pain management, but also introduced us to some new advances in medicine. Take a look. Good morning, doctor. Glad to have you on the show.
Good morning. Thank you for having me.
Absolutely. Of course, this is a very important topic that I'm sure a lot of our viewers want more insight into. We know the opioid crisis, doctor, continues to be such an uphill battle for patients, and they often start using pain medication because of the back pain or other pains that become chronic forms of pain for them. Tell us how you see people in your practice who can find alternative ways to solve their pain issues.
The key thing in pain management is to understand the actual underlying cause of the pain, to really identify the mechanism of action of that pain and try to treat that. Because the problem with pain pills, not only addiction and everything that we all know about, is the fact that they don't actually treat anything. They just mask the symptoms. So the big first question is to understand the why, on why a person has pain and how you treat that.
Right. I love how you pointed out that it's more like a Band-Aid, right? They don't get to the root of the problem because, especially, like, let's say you have major back surgery, the neuropathy, there's so many different things that go into play with that. People just want to find relief quickly, and so they go to these really quick fixes to do that. But you've invented and tested several medical devices, and are able to resolve chronic pain? Tell us how they work and the advances that you've made.
Yes, exactly. So when you have back pain, neuropathy, and nerve pain, a lot of times at the end of the day, it's the nerve that's firing the pain signal. And that is the fundamental crux behind the research that I'm doing, is to try to identify how to turn off those nerves from firing pain signals. And what I learned in my lab is that nerves use an electrical chemical signal to transmit signals from nerve cell to your brain, and then you experience pain. So we've discovered how to send repeating electrical signals to those nerves to actually block or interfere with the pain transmission to try to treat pain at its source, which is the actual nerve cell itself.
Right. It's fascinating stuff, doctor. Question: why aren't more patients being told about their options? Why is that such a secret? And are these new advances covered by most health insurances?
Well, first of all, a lot of alternative options to pills are covered by major health insurances. So it's important as a patient or as physicians to let people know about those and to try those. I don't think there's actually a secret about not trying alternatives. I do think that taking pills sometimes is an easy option. You just swallow a pill and a lot of times you feel better. But the problem is doing that is a bridge to nowhere, right? You're not fixing anything. You're not solving the root cause. Those pills and medicines can have an effect on your organs like your liver and kidneys, or you could become addicted to them and have a whole entirely different problem on top of your pain.
Right. Great point there. Now, you're the new president of the American Academy of International Pain Physicians. Can you provide any predictions on the future of treating chronic pain in patients? What does that look like? What's on the horizon?
There's so much advancements, and this generation of pain management is something that we're going to see a lot of new techniques. One of the most exciting things is something called regenerative medicine, using stem cells or using your own blood to inject something called platelet-rich plasma into your joints, even into the spine, into other areas, to jumpstart your body to heal itself, right? A lot of pain is from degenerative changes like arthritis or damage to a disc in the back. And maybe there are ways that we can use these new techniques to really help it heal itself without having to do major surgery. There's also advancements in artificial intelligence and machine learning that allow physicians to get all of the data that a patient has, all of their data points, imaging, lab results, etc., and then provide augmented decision making for us physicians to make objective decisions that would be in the best interest of the patient. Also very exciting. And of course, some of the research that I'm doing, I'm working on some non-addicting painkillers, pills to take, and electrical stimulation opportunities to try to block pain as well. And there's a lot of labs doing very exciting research. So this should be an exciting time for us.
It is absolutely exciting, and there's so much hope for pain management for people that are suffering. Dr. Amol Soin, president of the Interventional Pain Physicians. Great stuff, man. Thank you so much for chatting with us this morning on Inside South Florida.
Thank you.